Hello, and thank you so much for joining us today for this patient webinar on Attruby, or Acoramidis, for the treatment of ATTR-Cardiac Amyloidosis. My name is Rola Kadraki, and I'm a physician, and I specialize in advanced heart failure and transplant cardiology at Scripps Clinic in La Jolla, California. This is going to be our agenda for today. We'll go around and do some introductions in just a moment. But we're going to be talking about understanding ATTR cardiac amyloid. We'll do an overview of Attruby, or Acoramidis, for the treatment of ATTR cardiac amyloid. And then we'll talk about a patient experience in the clinical trial. And then lastly, we'll wrap up with financial assistance and support with a BridgeBio representative. The disclaimer is that the speakers were compensated for their time by BridgeBio. So we have Ken, who is our patient, who is joining us today, as well as Heather Polk with BridgeBio. This is the pipeline for Attruby, which has been more than 7 years in the making. You can see BridgeBio started clinical development of Acoramidis, or AG10 as it was called back then, in 2017. The ATTRibute-CM phase 3 clinical trial was started in 2019, where 611 patients participated in the trial from 104 centers around the world. The results from the trial read out in 2023, and the drug was finally approved by the FDA in 2024. So I want to take a moment to really give a shout out to the patients who participated in this trial to make this possible. Let's talk about ATTR cardiac amyloid. First of all, there's two different flavors when we're talking about ATTR. There's the wild type, which accounts for the majority of patients with ATTR cardiac amyloid, and this is caused by, we think, the natural aging process. The other form is the hereditary, which is also known as the genetic or variant form. And this is caused by a genetic mutation that can be passed down from family members. And regardless of the type, ATTR cardiac amyloid can really have profound and negative and devastating effects on patients and their loved ones. This is a serious and progressive heart condition, but the orthopedic and musculoskeletal symptoms do tend to predominate outside of the heart manifestations that patients experience. So up to 60% of patients diagnosed with ATTR cardiac amyloid experience carpal tunnel syndrome. Oftentimes this is in both wrists. Up to 40% of people also experience spinal stenosis, where the space inside the backbone becomes narrowed, causing pain, tingling, numbness, and muscle weakness. And that's really just the short list of symptoms that patients experience from an orthopedic and musculoskeletal standpoint. When it comes to heart symptoms, patients experience irregular heartbeat, like atrial fibrillation or heart pauses, shortness of breath, tiredness or weakness, swelling in the legs and feet, but patients also sometimes experience digestive problems and nerve pain. Accurate and timely diagnosis is really important. Otherwise, these issues can become really serious, and they lead to heart failure, more hospital visits, and early death. Unfortunately, the symptoms associated with ATTR cardiac amyloid can overlap with other heart conditions, making a formal diagnosis difficult to make, and it can take years. In one study, 42% of patients waited more than 4 years after presenting with symptoms for a formal diagnosis of ATTR cardiac amyloidosis. Patients experiencing ATTR cardiac amyloid report giving up on their hobbies and the activities that they enjoy doing, having trouble with daily tasks like household chores and bathing, and missing out on important life moments like visiting family and friends. Let's take a step back and really get into the mechanism and understanding the underlying biology here. TTR stands for transthyretin. This is a protein that we all make by the liver, and this helps to transport thyroxine, or thyroid hormone, and retinol, or vitamin A, around the body. So this protein made by our liver is made up of 4 smaller proteins that join together through these strong bonds. And that's what allows TTR, or transthyretin, to do its job as a transporter. In some cases, this TTR protein can become dissociated into single units, and those units then become very sticky. They tend to stack on top of each other. They can aggregate into these ropes that we call amyloid fibrils. And those then go on to deposit into heart muscle and other organ systems. So it's really important that we focus on stabilizing TTR, because when we focus on that upstream, then it becomes less likely that it will break down and cause trouble for patients. So we can actually measure how stable TTR is in the body, and this is done with a simple blood test called a serum TTR test, also known as a pre-albumin blood test. And the TTR levels will vary in healthy adults depending on age, race, nutrition, and levels of inflammation. So this brings us to Attruby, or Acoramidis, for the treatment of ATTR-Cardiac Amyloidosis. And this is used in patients with both the wild type or the variant form of ATTR-CM to reduce death and hospitalization related to heart problems. Attruby has been proven to positively impact survival, hospitalizations due to heart issues, and quality of life. The side effects we'll get into at the end of our program, but they can include diarrhea and abdominal pain. So Attruby was studied in a clinical trial of patients with ATTR-Cardiac Amyloidosis. There were 611 patients participating in the landmark ATTRibute-CM trial. 91% of the participants were male. The average age was 77 years. 10% of patients had the hereditary ATTR subtype. The majority of the patients were wild type in this trial. 58% had a history of atrial fibrillation, and 19% had a permanent pacemaker. So this really represents the real world in terms of patients that I see in my day-to-day practice in my clinic. The patients were randomized to Attruby versus placebo, and they were followed out for a 30-month study period. And the main outcomes that were examined were survival, the number of hospitalizations due to heart issues, and the examiners also looked at safety and changes in health-related quality of life and physical abilities and TTR levels. So Attruby works by stabilizing TTR. And what we've seen in the trial is that over 90% of the TTR proteins were stabilized with Attruby, as seen in the laboratory tests that we discussed, those pre-albumin levels. And TTR stabilization was seen as early as 28 days, and that continued throughout the 30-month duration of the trial, looking at laboratory tests of patients taking Attruby. And in patients treated with Attruby, over the 30-month period, based on a combined measure of survival and number of hospitalizations due to heart issues, patients that were taking the drug did better. And this was both for patients with wild type or hereditary ATTR-Cardiac Amyloidosis. And the positive impacts in terms of survival and hospitalizations were observed with Attruby as early as 3 months. So when comparing patients who were treated with and without Attruby, what we saw is that patients treated had an 81% survival rate versus 74% who were not taking Attruby, 50% fewer hospitalizations related to heart issues, and a better health-related quality of life. And if we look at quality of life in more detail, what patients reported was improved symptoms like shortness of breath and fatigue, physical abilities like the ability to walk a block and do household chores, and social engagement, like being able to maintain their hobbies, visit with family and friends. And those positive impacts on quality of life were also observed with Attruby after 3 months. So how can I tell if Attruby is really stabilizing my TTR? So again, that serum TTR or pre-albumin test can help to determine whether Attruby is working for you. And the higher that number is on the scale, the more stable the TTR is in the body. Now, this is just general guidance, and it's really important for you to ask your doctor about what an appropriate serum TTR test is for you, as this is a very individualized process. The side effects that we're seeing with Attruby can include diarrhea and abdominal pain. But for patients that were in the trial, these side effects were mild and they went away on their own so that they can continue taking Attruby without having to interrupt drug therapy. Some important safety information: before taking Attruby, please tell your healthcare provider about all your medical conditions, including if you're pregnant or plan to become pregnant, or if you're breastfeeding or plan to breastfeed. You also want to tell your healthcare provider about all the medicines that you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Again, the most common side effects of Attruby were mild and included diarrhea and abdominal pain that were self-resolved. As far as dosing, the dosage of Attruby that is recommended is 712 milligrams twice a day. That's 2 356 milligram tablets taken orally twice a day, and that can be with or without food. Attruby tablets should be swallowed whole. They should not be cut, crushed, or chewed. And it's really important to take Attruby as prescribed, and that way there's always enough medicine in your body to stabilize the TTR protein. The packaging, as you can see, was designed to facilitate compliance. It's conveniently labeled to help distinguish between the day and time of each dose. And sometimes what's helpful for patients is to pair Attruby with breakfast and dinner or another routine activity like brushing your teeth to help make it part of a normal routine part of your day. So I'd like to turn it over to Ken, who is going to be sharing his story today. And as a disclaimer here, Ken was a participant in the clinical trial evaluating Acoramidis in patients with ATTR-Cardiac Amyloid, and he's going to be sharing his unique experience today. So Ken, I'd like to turn it over to you. Thanks for being here.
Thank you. My name is Ken. My wife, Mary, and I are retired and live in Oregon. We enjoy travel, playing bridge, and spending time with family. Family includes our 10 grandchildren. All live nearby. We have 2 West Highland White Terriers, Tony and Cleo, or if you insist, Anthony and Cleopatra. I'd like to thank BridgeBio for sponsoring me to be here today to share my story of living with ATTR-Cardiac Amyloidosis. I feel fortunate that I can be here to share some things I wish I'd known when I was first diagnosed with this disease. Some of those watching may have had a similar experience living with ATTR-CM. One of the most important things I've learned is not to give up. I hope my story will encourage others to find and keep working with a specialist or healthcare team that is knowledgeable about ATTR and who keeps up to date on research and related options. In 2013 and then again in 2016, I had rotator cuff surgery on the right and left shoulders, respectively. After the 2016 surgery, I also experienced shortness of breath, which prevented me from swimming as far or as fast as I could before the surgery. I blame myself for not pushing hard enough to recover. In hindsight, there was probably another reason for my injury. I met a number of ATR fellow travelers who have experienced carpal tunnel or rotator cuff surgery, or both in my case. Maybe if I had sought a reason for the underlying cause of those injuries, I might have discovered the ATTR earlier. But I didn't visit a doctor with my shortness of breath complaint. Instead, in December of 2016, I had a stroke. I woke up with no feeling in my right leg. In a way, the feeling was interesting. I could walk, well, limp, but only by ordering my right leg muscles one at a time to contract or relax. I waited about an hour, foolishly I now know, for Mary to wake up and drive me to the hospital. Subsequent tests, primarily an EKG and MRI, revealed AFib plus an enlarged and inefficient heart. The doctors told me that blood pooling in the heart led to a clot. The clot swam to my brain and killed a few leg control neurons. I vaguely remember one of the doctors in the hospital saying, "You could have some form of amyloidosis." After seeing up to 12 doctors and early in the following 5 months of tests, blood test, urine test, bone survey, bone biopsy, fat biopsy, EKG, MRI, probably others, ATTR with cardiomyopathy emerged as the likely culprit. A heart biopsy in May indicated that I was, in fact, suffering from ATTR-CM. The cardiologist who had guided me through the testing process apologized, saying, "I don't know how to treat it." I sought a second opinion. After more tests, the second doctor confirmed the ATTR-CM and told me there's no available treatment. Mary and I did some internet research, and it confirmed what we had been told. Still more testing determined that the ATTR was wild type and not hereditary. I started thinking about the need to review our wills, show our kids where all our accounts were, make sure people knew my passwords, and generally make arrangements so things would be easier for them when my disease got worse. In October of 2017, Mary and I attended a support group meeting that we found on the internet. I wasn't looking for support and was reluctant to attend. Fortunately, Mary convinced me, pointing out that it could do no harm. The meeting turned out to be well organized and informative. One of the presentations was made by a local doctor who clearly knew a lot about amyloidosis. During an intermission, I asked him if he was taking new patients. He was, and 2 days later I became one. At our first visit, he said, "There is no FDA-approved treatment for your disease, but let's try some things." I liked his active approach, but nothing we tried produced the results we had hoped for. In April of 2018, that doctor noted that my heart was doing a poor job of pumping fluid out of my body. He put me in the hospital for fluid reduction treatment, and in 5 days, I lost 40 plus pounds, from almost 200 to around 150. Still, I was losing ground. I struggled to climb even a single flight of stairs without pausing halfway up to catch my breath, and our bedroom's on the second floor. Nothing seemed to be working. But then the doctor told me about a new phase 2 clinical study for a drug then called AG10, later named Acoramidis and now called Attruby. I trusted his judgment and recommendations, and by mid-2018, I joined the trial. This was a phase 2 study, primarily concerned with drug safety. The doctor was clear that the treatment was a stabilizer. It was not meant to be designed to cure my ATTRs, but to help slow down its progression by reducing further buildup of the protein fibrils affecting my heart. Since then, I've been taking Attruby twice daily and I'm pleased with the results. Since I began treatment with Attruby, I haven't needed to be hospitalized because of my ATTR cardiomyopathy. 5 years ago, as mentioned, I couldn't walk up a single flight of stairs without catching my breath halfway up. Not long ago, Mary and I were staying at a hotel where a fire alarm went off at 4:30 in the morning. We couldn't use the elevators, so Mary and I took the stairs down. Luckily, it was a false alarm, and rather than wait for the elevator, we decided to walk back up the stairs. I couldn't have done that before I started treatment with Attruby. Dr. Kadraki mentioned side effects experienced by some trial participants. I have not had any of those side effects, but others may have. Today I walk Tony and Cleo every morning. We don't walk fast, but I blame the dogs for that. Still, I have the breath to do it. Of course, I'm talking about my experience. Everyone is different and may have different results. I'm functioning far better than before I began taking Attruby. This may sound funny, but Mary and I turned 80 a few months ago. I'm happy that today I feel like a typical 80-year-old man, but probably there's no such thing. Again, I can only speak to my experience, and experience can vary from person to person. There's no known cure for ATTR cardiomyopathy, but today with the research being done, and with treatments like Attruby, I think we're getting closer. Now, people at support group meetings are talking about the future with optimism. I'm grateful that through my clinical trial participation and Attruby experience, I've been a small part of that progress. Thank you.
Thank you, Ken, so much for sharing your story. I think it really resonates with a lot of our patient viewers. It's a story that I've certainly heard from a lot of my patients in clinic. I think you highlighted just the difficulty in getting to the right diagnosis, the burden of the disease, and just what an impact being on treatment has made for you. And it certainly has created a lot of optimism and excitement. And I'm really excited to be a part of this, time period where we have these treatments for patients and we can really change the trajectory of their disease. So thank you. So I'd like to turn it over now to Heather Polk, who is from ForgingBridges, who is going to talk to us about financial assistance and access for patients.
Thank you, Dr. Kadraki. Again, Heather Polk, representing the ForgingBridges program. This is personalized support that is as close as a phone call away. The personalized support provides comprehensive overview for patients regardless of insurance type or even if you do not have insurance. We have a copay assistance program, so for eligible commercial patients, that might result in a $0 copay. We have a patient assistance program that would offer patients Attruby at no cost for eligible patients. And then lastly, we have a quick start program. This program would offer a limited supply of Attruby at no cost if you experience a delay of therapy up to 5 days or more. If you are viewing this telecast today, I would encourage you to scan the QR code at the bottom of the screen. This QR code will take you to ForgingBridges.com. Additionally, I'm going to provide a phone number where you can contact a ForgingBridges specialist. The number is 1-888-552-7434. There are ForgingBridges specialists on hand Monday through Friday, 8 a.m. to 8 p.m. Eastern Standard Time. Providing personalized support is very important and a hallmark of the ForgingBridges patient support program. You can connect with the patient access liaison for one-on-one support in addition to contacting a ForgingBridges specialist. The support that the PALs provide are educational resources on ATTR-CM, insurance coverage, including description of eligibility for Medicare Part D patients. We assist patients who have been prescribed therapy throughout their treatment. We help them navigate insurance and understand a variety of financial programs. Providing ongoing support for patients is critical, and we help these patients throughout the journey, checking in at key points. I'm going to turn this back over to Dr. Kajaki to take us away.
Thank you so much for that, Heather. So just to summarize our key takeaways for today, Attruby has been proven to impact survival, hospitalizations due to heart issues, and quality of life. Possible side effects may include diarrhea and abdominal pain, but for most people, these side effects were mild and resolved on their own so that they could continue taking Attruby without interruption. And with ForgingBridges, as Heather shared with us today, assistance with Attruby is available for all insurance types or even in patients who don't have insurance. So I'd like to open it up to questions, and I'd like to thank our audience members in advance for the questions that they've submitted. So I'm going to start with the first one here. Why is it important to stabilize the TTR protein? So this is a great question, and it really goes back to the fundamental underlying pathophysiology of the disease process, where ATTR, cardiac amyloid, stems from the liver and the TTR production from the liver becoming unstable and misfolding and aggregating and forming those amyloid fibrils. So the more we can stabilize that TTR protein, we can prevent this process from happening downstream and causing the manifestations of cardiac amyloid that we discussed. So our next question here is a good one regarding a patient experience. This patient says, I haven't been to the hospital for my ATTR-CM. Will Attruby help reduce my chances of having to go to the hospital in the future? So I think this is what's really exciting about this therapy, is that what we've seen in the clinical trial is a 50% lowering of the risk of hospitalizations. And that was in patients who have had a prior hospitalization as well as patients who did not. This next question is for Heather. This patient is asking, will Attruby be covered by my insurance?
Insurance is a very personalized decision, and it's unique to each patient and care partner. So we understand health insurance varies from person to person. We offer support regardless of insurance type through the ForgingBridges program. The programs vary in assistance, again, for any type of patient or any type of insurance, even if you do not have insurance. For patients who are prescribed Attruby, ForgingBridges can help patients get started, navigate insurance, understand financial programs, and then most importantly, stay on track with their treatment. You can contact ForgingBridges again at 1-888-552-7434. Please talk with a specialist to connect with your patient access liaison to learn more.
Thank you, Heather, for that. There's another related question here for you. What if I can't afford to pay for Attruby?
Sure. That may be your situation. However, we're committed to supporting patients, again, with any type of insurance, and even for those who do not have insurance. There's comprehensive financial support that's only a phone call away. Eligible patients will pay as little as $0 copay for if you're commercially insured. If you are eligible, you may be able to access the patient assistance program where Attruby would be available to you at no cost. And then lastly, the Quick Start program provides a limited amount of therapy while your provider works through your case if there is a delay in working up your insurance.
Mm-hmm. Wonderful.
If you're not eligible for any of these programs, we can connect you to organizations that may be able to help. Please reach out to ForgingBridges.com or call the Forging Bridges specialist at 1-888-552-7434 to speak with a specialist who can help you learn more.
Fantastic. So there's really a lot of support and help for patients.
And it's variable. I think that's the most important thing. So no one patient journey is going to be the same.
Right.
And we really focus on providing the appropriate support to each patient based on their unique needs.
Right, right. Okay, thank you for that. Our next question is here. Why would I need to take Attruby twice per day? So this is also a great question. This is related to the clinical studies and what was observed as far as maximizing the stabilization of the TTR protein. So again, it's 2 tablets taken twice a day in that friendly packet, patient-friendly packet that we went over. And that's just what was shown in the trials as far as maximum TTR stabilization. When may I see improvement in my symptoms? So this will be different on an individual basis, but in the clinical trial, the quality of life improvement was seen as early as 3 months. And that also included survival and hospitalizations due to heart failure as early as 3 months. But even the day-to-day symptoms and quality of life metrics that patients experience were also on the order of around 3 months. But again, individual results are going to vary. Each case is different. Ken shared his story today, so this will be variable from patient to patient. So it looks like those are all the questions that we have, and I'd like to close up our program and really thank both Ken for being here, for sharing his story, and for really helping to push the needle forward for our patients and for the field by being a participant in the clinical trial that made this drug possible and made this conversation possible today. So thank you for that. And I'd like to thank Heather Polk for her insights with regards to patient access. Thank you so much, Heather. For more information about Attruby and ATTR-CM, please visit attruby.com or our YouTube channel and talk to your local patient access liaison or PAL for information about our other upcoming programs. So thank you again. Thank you to our viewers.
Thank you, Dr. Kataki.
Thank you.
Thank you.
Thank you.